Hello, everyone. Let's proceed to face diagnosis review. Start with the face. Okay, what is your diagnosis if the whole face is red?
Heat po,
Di ba
no?
kanina the tongue?
Heat.
Heat. But if the whole face is red, it's excess heat.
Food heat.
So if it's only part of the face, like the malar flush lung, that's empty heat. Di ba? If the whole face turns red, that's excess heat. Okay, this is the one. Malar flush, tidal fever, night sweat. Night is yin. You're not supposed to sweat, but there are people who sweat. So that means they have what we call. Then when you look at their tongue, what do you expect to see? This is called deficient heat or empty heat. Remember empty heat? What will be the color of the coating in somebody with empty heat?
Walang coating daw.
Wow,
No coating.
ay grabe, hindi talaga kayo ba? There is no coating, the
No
color of the
coating.
tongue. Okay. What about if the face looks dull, white, or withered? Parang nalanta.
Blood deficient siya.
Wow, very good. Bright white. Oh, but puffy with a bloated look. And when you look at the tongue, it's a little bit slightly wet and pale.
Young deficiency.
Yes, yang deficiency. O, diba? So if you're not sure about the diagnosis, you look at the tongue. O, kung kaya lang natin talaga mag-pulse, kaya lang ayaw niyong magstay ng 11 eh. Kayo rin. Joke lang. Bluish white face. Kanina, red all over, excess heat. Now it's,
Excess cold.
yes, wow. Okay. Smoky, dull, yellow face. Remember, yellow. Smoky, dull, maaso na.
Dump.
Damp, what?
Dump heat.
Okay.
Cold damp.
From the tongue of this person.
Yellow coating.
Yellow.
Thick yellow coating.
Yun lang.
And thick.
Sticky
Thick siya daw.
coating.
Sticky coating.
Yellow sticky coating. Slippery coating, di ba?
Yes daw.
And
Saka
red.
mataba.
Yeah. Dull, pale, yellow face. Kanina, it was smoky dull. So you said damp heat. Just like when you cook barbecue. Okay. Ito naman, dull, pale, yellow face. Sir Robert, you're silent. Kaya mo yan. Kung ito, damp heat, smoky, dull, yellow face. So yellow, there is the damp. Ano naman to? Dull, pale, yellow face.
And empty heat.
Ano empty heat? Cold damp.
Cold down.
Ito naman, empty heat bigla. Kanina pa yung empty heat. Ito naman, ash-like, yellow face. You didn't do your assignment.
Dok, parang iba kasi dito sa yung pinadala mong face reading.
Hindi, ito yun.
Hindi, Dok.
Ay, baba, sorry.
Opo,
I-edit
Dok.
ko
Kasi
yata. Ay, sorry. Long-standing damp. Sallow yellow, pale yellow, without the brightness face. Ay, iba yung napadala ko. Ala, sorry. Mas
hindi,
mahaba
Dok. Kasi
pala yun.
parang sample lang in your pale yellow complexion, it says here, spleen and stomach chi deficiency. Doon na siya agad sa
Yeah,
Ganun.
just like this one, spleen stomach deficiency or blood deficiency. sallow yellow
Sallow. Pale yellow.
without the
Okay.
brightness. You
Yan
don't.
na lang.
Okay, what if the face is green?
Sa bile yan, look.
Yeah, so liver patterns.
Liver.
Did you know that you need to also be familiar with the liver patterns? Liver blood deficiency, liver young rising,
Yes, doc.
liver fire, liver interior cold, pain, or liver wind. Actually, if yung mga in pain, tingnan mo yung mukha nila parang green. Now let's go to the eyes. If you have iridology, this one is eyes in general. Okay, what is the state of the eyes telling us? What are we trying to look for here? The Shen and the Jing. Shen is the spirit, and we all know that the Shen is housed by the heart. So for people with heart blood deficiency or heart yin deficiency, they cannot house the Shen. That's why your spirit is restless. You have cravings. You're restless. You have dream disturbed sleep. No? And you can see that even if the person is smiling, just look at the eyes, you would know the Shen and the Jing. Jing is your essence, and it is stored by the kidneys. Does it make sense? The heart and the kidneys, they're like fire and water. Okay? In the future, in the near, especially when we meet for practicum, you will realize that if you see issues with the heart, you should always consider the kidneys because they are supposed to be in communication. Make sense? The heart needs the coolness or the of the water because water kidney is water element. Okay, the heart would need the coolness or the water of the kidney for it not to be so hot. Okay, otherwise you know you cannot you cannot rest, you cannot have a good sleep. Okay, you feel agitated, you'll have anxiety, all these things. And the kidneys will need to rely on the heart for the fire. And the kidneys are very sensitive to cold. You knew that. So if you see a tongue that is red, especially when the tip is so red, what is that telling us? That means the water element is not strong enough to be able to control the heat. So you should do something about the kidneys. Make sense? There are also some people who will present with a very swollen tongue or pale tongue. They feel cold. So that means the heart is unable to provide the heat. Okay? So good practitioners will always consider that principle. Okay? There's a lot of things to talk about when it comes to Shen and Jing. In fact, we have the so-called Shen, Qi, and Jing cycle axis. Okay? But that's another story. Let's look at the eye corners. You know, the canthi here. This is inner medial canthus. This is lateral canthus. Okay. This correspond to the what? What organ?
Heart.
Yes, very good.
The inner?
Yeah, the inner.
Inner, yeah. Right.
The upper eyelids. Okay, I don't want to mention names. I'm sure you've seen the upper eyelid, the upper lid of a previous government official. Di ba bumababa na? So what is that telling us? So if the inner corners are the heart, the upper lid would be
The lungs.
the spleen. Spleen. Actually, you need to, this is we have the so-called levator palpebrae superioris. It's a muscle, and muscle is spleen. So you treat the spleen, tonify the spleen, and you'll be surprised. And remember, spleen and the stomach, they work together, okay? If upper lid is spleen, the lower lids would be
Stomach.
stomach. Very good.
No stomach.
The sclera of the eye, or the white of the eye. I hope you're familiar with the anatomy of the eye. Will tell us about the,
Lung.
yes,
Galing ni Doc Angelia.
iris. But see, iridologist. The iris of the eye is
Liver.
liver. Did you know that the liver can do so many things? In fact, in Western medicine, it has so many functions. Okay? And if you affect the liver because of emotional stress, this can give you a lot of problems. So I think that's the reason why iridology makes sense, no? Okay. The pupil of the eye. You know the pupil? Where the light passes through? That's the, what is the kidneys? Makes sense? The iris is liver, the pupil kidneys. If you have wide pupils, that means you have strong sex appeal. I don't know if it makes sense. Do you agree with that, Sir James? Okay, I don't know. But anyway, the pupil is it's actually an aperture. It's an opening where the light passes through. So if it's too bright, too much light, the pupil will constrict. If it's too dark, the pupil will have to dilate. So this is something to do with kidneys. Okay? Diba? Like, you've seen how a mortician, how do you call it? Like when you do autopsy, or like when you check if the person is really dead, they look at the, diba? They observe the pupils. So if it's like dilated na, it doesn't, kasi when you flush a light on the pupil, it will have to constrict, but it doesn't constrict anymore, then that means it's the end, no? So if there's a red color in the corner of the eye, the canthus, we call it, canthus, plural is canthi. What does that mean? Red means?
Heat.
So what's that? Diba? What is the organ there? It's heart. Okay.
Heat in the heart.
So look at your inner canthus. There are two.
Fire.
That's heart fire.
Heart fire.
Yes.
Heart fire.
Now, what about if it's dull white? It's only dull white. There is heat. Please don't ask me why it should be heat. But remember, it's dull. Pale white color in the corner of the eye. Pale. In fact, when you are found to have this condition, it's not it's supposed to be a symptom, no? That your doctor will look at the lower eyelid, no? The palpebral conjunctiva, no? And find out if it's like paper, the color of paper. So what do you call this? There is blood deficiency. So my question is, what do you expect to see in the tongue? Sir Robert. Nakita mo, the canthus is pale white. Oh, but blood deficiency. How do I confirm it? Using the tongue. Kulang ang blood. First, Sir Robert, Yeah, pale. What else? Will you expect a tongue to be
Thin.
thick or thin?
Thin po, thin.
Thin. Will you expect it to be moist or slightly dry?
Dry.
Wow.
Sorry.
Bakit mo babaguhin? Okay, yun na. And also, when we
Dry.
do the pulse, isn't it exciting, di ba? When we do that's another story. Oh, we have a deficiency here. What did you talk about deficiency with regards to strength of the pulse? Should it be
Weak.
forceless or forceful?
Forceless.
Forceless. Okay, when we study pulse diagnosis, we're going to, like when you have blood deficiency, you will notice na yung thready pulse. Di ba manipis lang eh. Thready pulse, you have wiry pulse, slippery pulse. We have the other pulses. For all you know, you will use only 3, 4. Okay. What about if you have a red color of the sclera? The sclera is lung, remember? So if it's red, what does that mean?
Heat in the body.
No, lung na eh, lung. Tapos
Ay,
lung heat.
lung heat. Fire in the lungs, sasabihin ko doon.
Lung heat. Okay, yellow yung color ng sclera. What does this mean? Remember, meron tayong tinatawag na jaundice, but let's do this using the principle that we learned earlier. So sclera,
Phlegm in the lungs.
Damp heat.
damp heat. Very good.
Ay,
Whole
damp
eye
heat
is
pala.
red, painful, and swollen. You have
Heat in
two
the body.
answers.
Liver
Heat.
fire.
Yes, liver fire rising or liver yang rising, or you have, di ba yung iba nagagalit? Or you have exterior wind heat. Kagagaling mo sa super init na area. Okay? Swelling under the eyes. You saw that your patient, but this is more interesting than the last one I sent you. Sorry for that. So I think this is easier. Swelling under the eyes. But there are people who are like that. They call them eyeballs. What organ?
Kidney deficiency.
Kidney deficiency. Very good. Top of the sclera. What are you looking for? Top of the sclera.
Bladder.
The back. The bottom of the
back.
sclera would be the chest. Okay, green, blue, purple, or red spots on the sclera that appear at the end of the red vein. These are lesions within the back or chest. Sige lang. Good to know na lang to. Okay, if you see spots on the sclera that are not attached to the veins, what does this mean? There is no pathology.
Inborn yung iba, Dok, no?
No pathology. There's in congenital. Gray at
Okay.
scattered spots on the sclera means chi stagnation. Okay, let's discuss chi stagnation. When you have chi stagnation, what does it mean? The chi stops
Okay.
moving,
No energy.
stagnates. And the most common organ, the most popular organ in charge of facilitating the flow is the liver. So a very distinctive feature of chi stagnation is the standing pain. Yung feeling mo parang nag-bloat ka tapos parang lumaki dan masakit. Okay? So, if you are so emotionally stressed, sometimes you will have the standing pain. Okay? And the pain would migrate from one area to another. Obviously, when you do not address the chi stagnation, lumala ng lumala, what will follow? What will stagnate next? Chi is supposed to be the commander of
The blood.
blood.
The blood.
So once the blood stops moving, or when it has blood stasis now, what will happen? The pain will now be more fixed in one area, and even the character is very distinctive. It's going to be stubbing or pricking pain in one area. Okay? So if you have blood stasis, what are you going to look for in the tongue?
Bluish tongue.
Anong bluish tongue?
Gray.
What
Okay,
what's
black
the
and black.
purple, right?
Purple.
Purple depends on what organ, diba? That's blood stagnation, blood stasis. Okay, if you see deep black spots on the sclera, what pattern are we talking about here? That patient must have this pattern already. Look at your sclera. If you see deep black spots, you probably have blood stagnation or blood stasis. Diba? So aside from your expertise in just looking at the iris, you probably would want to include this.
Yeah.
You look at the entire, it's like, I'd rather look at the forest than the trees. Okay. But it's good to know the trees, all the plants there, no? But there's such thing kasi as like you get a bird's eye view of everything. So if you have gray surrounding the black spots on the sclera, what do you have? We have chi stagnation and blood stasis. So look at your sclera later and find out if you have blood stasis or blood stagnation. So if you have blood stagnation, then expect to see purple sublingual veins. Now, red spiral-shaped veins on the sclera will tell us that the patient is in pain. Pain. So, look at the sclera, aside from your iris. Di ba mauna mo muna makita yung sclera? Doon pa lang alam mo na, oh, you're in pain. So you have to be able to address the pain right away. And remember, when we treat pain, you need to know the cause.
Yeah.
You can only find the cause by looking at the tongue. Okay? Now, what if you see gray and scattered spots like clouds in the sclera? So there are injuries that lead to chi stagnation. Did you know that pag nagkaroon ka ng injury, it will definitely affect the flow of chi? So there is a technique in acupuncture that will help you address those issues. Okay? Now, if you see black spots surrounded by a gray cloud like halo, you have both chi stagnation and blood injuries. Okay? Now let's go to the nose. This one is interesting. Diba? Mas madaling makita. Bridge of the nose, what organ? Sir Robert.
Heart.
All of you are members of the in the chat, no? Kasi or probably you asked Sir Albert to provide you with, just in case you were not added to the group chat, no? Bridge of the nose is
Liver, doc, liver.
liver. Wow, alam na alam. Okay, good. So tinan yung mga mahilig uminom. You know, when they have acne rosacea here, malalaman mo kung of greenish. Okay, if the bridge of the nose is greenish, what does it mean? This is the most common condition that you see in the clinic. 70% of depression is caused by liver chi stagnation. 70, 80. I'm not so sure. Liver chi stagnation. In fact, I'm planning to give a lecture on this. Kasi I know, let me tell you, you can help a lot of people. And I've done this on most patients. You can never go wrong with liver qi stagnation. So I'd like to share that protocol with you. Grayish or dark bridge of the nose. Remember, grayish na siya. So it's not very good, no? Yeah, stasis. Very good. Liver blood stasis or liver blood stagnation. Most likely the patient may have cirrhosis or yeah, I had a patient who had cirrhosis because when he met a vehicular accident, he was transfused with blood that was not tested for hepatitis C. Mhm. So he had it. Uh, so he developed cirrhosis after 10 years. It started with fatty liver, of course. And then he just said goodbye last month. Liver cancer. Okay. So red bridge of the nose. Yan, yung mga mahilig uminom. Sir Robert, what's the diagnosis? Liver.
Fire.
Liver fire.
Very good. Wow, was that a very intelligent guess? Tip of the nose. Okay, look at the tip of your nose now. What organ?
Spleen. The spleen, though.
Spleen.
Spleen.
Spleen meridian.
Okay.
Is-
If the patient is complaining of abdominal pain from cold in the spleen, you know why most people develop abdominal pain? They love cold food.
Mhm.
And then they live in cold places. And what are you going to look for? Okay, spleen ito. So we're talking about the tip. So the question is, what will be the color?
Pale.
Green or blue.
Yes,
Mhm.
green or blue. Galing naman.
Doctor.
Si Doc-
A research book.
Okay, kung yellow. We will not go into detail talaga dito, ha? Kasi I think the most challenging here would be the tongue and pulse. Yellow tip of the nose.
Damp heat.
Damp
Doc.
heat, ang galing in the spleen. White tip of the nose. Meron palang gano'n.
Mhm.
Okay.
Alam ko lang cold nose.
White tip, wala nang dugo. Ma'am
Blood
Letty,
deficient.
blood deficiency. Ang galing. Red tip of the nose. Okay. There's heat in the
Heat
lungs
in the
and
blood.
spleen. Pumasok na si lungs. Because you know why? The lungs and the spleen, they have the same polarity. Okay? They are, the lung is called the hentayin, while the spleen is called the futayin. Kaya madali siyang, what's this? It easily gets affected by heat. Diba? Kaya keep your lungs cool. Kaya don't smoke if you're not smoking already.
Mhm.
Yun. So remember, if the lungs are affected, the spleen also is affected and vice versa. Gray tip of the nose. What does this mean? Doctora,
Blood stasis.
there is
What is
impairment of water movement.
it?
Nose is moist and shiny. What is it? Is it a good prognosis or a bad one?
Ba't pang moist?
Moist.
Supple,
Good
not
prognosis.
Good prognosis. Good. Hindi
moist.
siya dapat tuyo. Okay, if the nose is dry, anong ibig sabihin nun?
Heat.
Okay, for
Heat.
those heat. Saan?
Heat.
Stomach heat.
Stomach or
Very good. Who's the
large
partner of the
intestine.
stomach aside from the spleen? Stomach and large intestine. Yeah, thank you,
Large
Deborah. You
intestine.
got it. Stomach, diba? Yang Ming. Stomach is Foot Yang Ming or Great Brightness. Large intestine is Hand Yang Ming. For more details, subscribe to Acupuncture and watch the ads. Sorry, joke lang.
Yes, watch the ads.
No, I'm sure you won't do that. Nose dry and black.
Blackheads.
Ano black? Toxic heat.
Toxic heat.
Infection. Okay. Thank you, Doctora. Okay, now let's go to nasal discharge. Okay, di ba? Pag may sipon ka, tingnan mo yung discharge. Is it clear and watery? So what is the pattern? Hot or cold?
Cold.
Cold. So yung mga taga Baguio, ganun yung mga,
Nipples, Doc. Nipples.
yeah. Yeah, sniffles. Thick and yellow nose discharge. Ito yung medyo may amoy, no?
Damp heat.
Yeah, heat pattern or damp heat. Yeah. Flaring nostrils with high fever. Have you seen somebody who's always on oxygen? Ano?
Mga may
Pero,
emphysema.
oo,
Ganyan.
napansin nyo yung nagfe-flare yung nostrils. Okay, nagfe-flare with high fever. Extreme heat in the lungs. Kaya dapat yung lungs natin parating hydrated. You cannot allow it to be, kasi it's very yin. So konting init lang yan, affected na yan. So yung mga naninigarilyo, you might probably think of quitting. No? Green color on the nose. We discussed this earlier. Nakita mo, green yung nose.
Liver.
May abdominal
Liver
pain.
heat.
Yeah.
Abdominal pain.
Liver heat or may chi stagnation with abdominal. Now let's go to the ears. Yesterday we were focused on sa loob ng no. What about if nakasakay ka sa jeep or sa bus, nakita mo yung ears niya maputi? Okay, what is the normal color of the ears? They should have the same color as your face, as your body. Okay? Now you notice the ears are white. Hindi naman siya white. What does the patient have?
Young deficiency.
There is
Deficiency.
chi stagnation with abdominal pain. Okay? Meron siyang issue. Meron siyang pain na palipat-lipat. Sometimes the doctor will not know what to do. Just give pain relievers. Diba? So they should come to us. Okay. Bluish black ears. Blue-black. Nakita mo ay? Ay, pasyente.
Cold or blood stagnation.
Yeah, chi stagnation or blood stagnation. Yeah, there is pain. Very good. Ang galing. So ito, diretso na to. Ma, meron kayo na iniindang sakit. So this time you look at the... Okay, then you saw na... Okay, we took this up last night. Dry, withered, and black ears. What is
Exhaustion
of what?
Jing, kidney essence.
Okay, kidney
Wala na.
Wag naman kidney essence, mauubos na. Kidney chi exhausted.
Kidney chi.
Yan.
Shiny and moist earlobes. Just like the nose is moist and shiny.
Normal prognosis.
Good,
Yeah,
Good
good
prognosis.
prognosis.
Dry and withered earlobes. So, okay. Dry and withered. So, tingnan nyo yung mga earlobes nyo. Earlobes, itong dito, not the whole ear.
Poor prognosis.
Poor prognosis. Swelling pain in the middle of the ear. Swelling, parang lumalaki. There is heat.
Inflammation, heat.
Lesser yang channels. Shaoyang. We have the gallbladder and the sanjiao. Okay? For now, memorizing lang muna yan. Swollen ear. So if you see a swollen ear, what comes to mind right away?
Dampness.
Merong
Heat and
pathogenic
damp.
factor. So, what will you look for in the tongue? You look for excess, the coating, di ba?
Yeah.
May
Like
pathogenic
cold
factor. Ibig sabihin, pumasok na. What about if you have a thin ear?
deficient.
Yeah, deficiency. Qi deficiency or blood deficiency. Long and full earlobe. Kaya keep pulling on your earlobe.
Long life.
O sige.
Good constitution.
Earlobe ba?
Kid-
Strong constitution. Wow, very good. Sige, hilahin pa more. Ay, nako. Ay,
Long
nako.
earlobe.
Oo nga pala. Kaya pala sicklish yung isa pa. Yeah, I had a patient the other day. Parang wala siyang earlobe.
Oh, wow. Oh, weak constitution siya.
Poor constitution. But it's not the end of the world. That means you have to really do something na, no? Next, we go to the lips. Pale red, moist, and shiny lips. So without the lipstick, no? Should be pink or pale red. Moist and shiny. What does this indicate?
Good prognosis.
Normal.
Normal spleen. Because spleen
Oh, spleen.
will manifest as the lips. Okay? So look at your lips.
Good
But if you have pale lips,
cold.
Blood
Blood
deficient.
deficiency.
blood deficiency or yang deficiency. So you also check the tongue, no? Feel the pulse. Red and dry lips.
Heat. Fluid
Dry.
exhaustion.
And heat.
Yun naman,
Heat.
with exhaust. Heat in the stomach and spleen. Remember, lips lang yan. Lips pa yan. Or baka
Heat in
ang dami
stomach.
mong kinain na ano, maanghang, junk food.
Maraming ganyan, bro. Heat in the stomach and spleen. Maraming ganyan.
Red and dry, maraming ganyan. Because of the diet siguro. Purple or bluish lips. Oh, there's the key word again, purple.
Stagnation. Stomach.
Blood stagnation. Very good. Purple. When you see the word purple, blood stasis or blood stagnation. Now, if the mouth is slightly open, what is the pattern? Full or empty?
Full.
Empty.
Empty.
Lung qi deficiency.
Mm-mm.
Empty.
Okay.
Breathing through the mouth.
Lung qi deficiency.
Wow, ang galing naman. Saan ba tayo dapat mag-breathe? O, diba?
Nose.
Ano?
The nose.
Greenish ang area around the mouth. Remember, green.
Pain. Stomach pain.
Yes.
Liver.
There's stagnation. Liver blood stasis or liver qi stagnation. Yeah, pwede rin stomach because you know what? The liver can affect the stomach, it can affect the spleen, it can affect your lungs, it can affect your heart, everything. That's why liver qi stagnation is something very concerning. No? Kaya you cannot blame if yung iba nagwawala. It's healthy for them. And you just choose. You can have a heart attack or you can have a stroke or cancer. Now let's go to teeth and gums. Okay, tell us about the teeth. The teeth,
Related to kidney.
yeah, under the
Extension of the kidneys.
extension of the bones, under the influence of the kidneys. So, may kinalaman ng kidneys dyan. The gums. Sino nag-control sa gums?
Stomach.
Wow,
Stomach.
galing. Stomach. Swollen. What if you have swollen and painful gums? So we all know that the gums, stomach. What if it's
Stomach
swollen?
heat.
Stomach
Heat in the
heat.
stomach.
Very good. Wow. Swollen only, but not painful gums.
Spleen dampness.
Okay, let's ask
Stomach.
empty heat of the stomach.
Empty heat.
So that means hindi siya full heat. Yung kanina full heat, no? Ito empty, hindi kasi painful. So I'm sure matutuwa si Doktora Templo dito. Lahat na ng mga pasyente niya, ay, kaya pala mabaho yung hininga. Okay. Ay, sorry.
Ecolonics natin yan.
Kalo. I think it makes sense, no? You know what? Because the large intestine and the stomach, they belong to one, the Yang-Ming channel or Greater Yang channel. So, pale gums,
Stomach yung deficiency.
stomach
Spleen
blood,
blood deficiency.
blood.
Blood deficiency.
Moist teeth.
Normal.
What does the
Good
tell?
prognosis.
Sabi nyo yung teeth kidneys. So what is this telling us about the kidneys if your teeth are moist?
Good prognosis. Kidney
Good
constitution.
prognosis. Very good. Dry teeth. Have you seen patients with dry teeth, Doctora Templo?
I can't identify dog.
So this time, oh, you have kidney. Ah, yeah. What is the pattern? Kidney,
Baka yung enamel ng teeth.
kidney yin deficiency.
Deficiency.
Bright and
Wala
very
na
dry teeth.
enamel. Empty heat.
Heat in the bright.
Kidney essence.
No.
Yung
Very dry, bright. Heat in the bright yang or Yang-Ming channels. Stomach
Vital
and large
kidney.
intestine. So that means they need colony. Dry and loose teeth. What does this mean? What does this indicate?
Empty heat from kidney deficiency.
Yes. Kidney yin deficiency or kidney yin deficiency.
constitution.
Okay, what if you have bleeding teeth? Bleeding teeth, bleeding gums siguro. Sorry, this is
Oo.
bleeding gums. Bleeding teeth. Pero ba nagbe-bleed na?
Gums siguro rin.
Bleeding gums ito, sorry.
Gums.
Stomach fire.
Stomach fire
Spleen
pala.
heat.
Stomach
Heat in the
fire.
stomach.
Or stomach fire. Very good. Swollen and painful gums. Ay, paulit-ulit.
Ganun din. Stomach fire. Heat in the stomach.
Yeah, stomach heat.
Stomach heat.
Swollen without painful gums.
Damn.
Stomach empty heat.
Stomach empty heat. Now let's go to the pharynx. I think this is the last one.
May pharynx pala.
So that means you have to look at the throat, no? Now, if you see a deep red pharynx and it is an acute condition, what is the diagnosis?
Lung heat. Invasion of lung heat.
Exterior
With
invasion.
heat pala. With heat.
Okay. Pag chronic condition, deep red,
Lung yin deficiency.
or stomach heat.
Stomach heat.
Okay, if you see erosion, redness, and swelling, meron siyang toxic heat of the throat.
Okay.
Okay, chronic, sore, and dry throat that is not swollen or red also has empty heat.
Lung yin with empty heat.
Ang galing naman. Lung and kidney yin deficiency. Pale red throat.
Normal ba yan? Pale red is pink. Normal.
Empty heat affecting the lung and kidney
Empty
channel.
heat.
Erosion, swelling, yellowish red pharynx. Oh, do you notice a pattern?
Toxic.
Paulit-ulit lang, di ba? So there is heat.
Toxic heat.
Heat in the stomach and intestines. Chronic erosion that comes and goes. On and off. Empty heat. Okay. Chronic dryness and erosion with grayish ulcers. Wala na. Severe yin deficiency. Malapit na tayo matapos. Chronic erosion with ulcers
Dryness.
that have
Yield
raised
deficiency. Empty heat.
edges. They have to refer to the doctor. Blood stasis with phlegm heat. This could be cancer, no? Especially when you see these things, so may clear ano talaga demarcation, raised hard edges. Okay? So that's why you have to wear gloves, okay? Of course. Swollen tonsils with normal color. Swollen tonsils. Tatapos na rin. Phlegm or
Tonsillitis.
gum retention with Chi deficiency. Red and swollen tonsils. Red, no, wala.
Elevation of heat.
Toxic heat or heat. Transient,
Heat.
red and swollen tonsil.
Heat pa rin, no?
Heat pa rin, chronic, comes and goes. Heat in the stomach or large intestine or empty heat in the lung channel. Napansin nyo, pag may mga stomach ulcers, may makikita kang dugo din sa pagdumi. Diba?
Mm.
Red and swollen tonsils with exudate. This is wind heat. And
Toxic.
finally, yeah,
Toxic
raised
heat.
tonsils. This is very common in children. Okay, this is the acute stage of infectious mononucleosis. Have you heard about it? It's caused by Epstein-Barr virus,
Virus.
glandular fever, viral infection to. Very common.
EPP.
Thank you very much. We're done. We are now open for questions. How about, while you're preparing for... Wait lang, I'll stop this.